we've been working on and offering a solution now for 5 or 6 years that's very technologically based to help clinicians solve that problem of how do you try to start to distinguish what's going on with a positive test. What does it really mean? Okay? So this RX Guardian technology we've had for 5 or 6 years has a new enhancement called RX Guardian CD that started last May. And it was developed using data and an algorithm from the Marshfield Clinic. And the way that it works is there's 2 parts to it. Part number 1 is it corrects the urine drug levels for what we call physiologic variation. If you drink 2 quarts of water and then have your urine tested, your drug level is going to be very low because it's dilute. If you just worked out and you're dehydrated, that same person on the same amount of drug is going to have a very high urine drug level. So the Marshfield Clinic patented an algorithm, a formula, that uses urine-specific gravity as a way to correct for how hydrated you are, and lean body weight, which is a function of height, weight, and gender, to talk about how big you are, how much muscle mass you have. It's kind of like body mass index, which a lot of people know. This formula makes that urine drug level now have meaning. It corrects for those factors. So that's part 1 of the tool, adjusting the urine drug level. Part 2 is the pain clinicians at the Marshfield Clinic for about 6 years have been using a protocol to identify patients that they can deem to be extraordinarily likely to be taking their medication correctly. And they do that by about 6 different ways. First, they ask the patient, how did you take your medicine? When did you take your last dose? Okay, that's part of it. They look at refill histories. If you're writing the prescription every month, is the patient refilling the prescription at the right time, or are they coming in early or late? They look at aberrant behaviors, which is the classic things in pain medicine, things like patients saying they lost their prescription or their dog ate it or they go to the ER for all their refills. There's a classic set of aberrant behaviors. They look at urine drug tests over time, and they test frequently at the Marshfield Clinic. And if someone has an illegal drug or the opiate's not in their body, they're deemed to be likely non-adherent. So now with RX Guardian CD, when a clinician sends a drug monitoring test to us, we adjust the drug level for hydration and for body weight, and we compare that adjusted level to what it looks like it should be from the Marshfield database. And we actually now display it on a bell-shaped curve, and doctors can quickly look at the bell-shaped curve, and if you're within -2 to +2 standard deviations, you look like the 95% of people in the Marshfield database who are adherent. If you're out on the tails, you quickly can see that it looks like the patient's drug level is too high or too low. So that's something we developed. So there's a lot of technical stuff there, but the bottom line is, even though it's not a perfect test, it's helping doctors to solve that problem of what does a positive test really mean. And if it's high or low, you really should review the medical history and talk to the patient. Try to figure out what's going on.